Everybody, thank you for joining us today. I'm Jen Kovich-Bordnick with the eHealth Initiative. We'll be getting started in just a moment. We're going to let folks sign on here for just a minute. We're delighted you could join us today. This is a really critical issue, and we're delighted you're joining us this morning. We've got several hundred folks joining us this morning, so we want to make sure that everyone has a chance to log on. I think we're going to go ahead and start getting through some of the introductory comments and begin, because we have several esteemed congressmen and women with us here this morning. We're delighted to have such an esteemed panel today, so welcome. Why don't we go ahead and hit record and get started? All right? Great. Good morning. My name is Jen Kovich-Bordnick. I'm the CEO of the eHealth Initiative and Foundation in Washington, D.C. Welcome. eHealth Initiative convenes executives who are transforming healthcare through tech and innovation, and that's one of the great topics we're going to be talking about this morning. We are so proud to be a co-sponsor of today's rally and session with AdvaMed, the Alliance for Connected Care, the American Telemedicine Association, the Consumer Technology Association, the Health Innovation Alliance, HIMSS, and the PCH Alliance. All of our organizations have come together in a united front to urge Congress to ensure that Medicare telehealth reimbursement continues after the COVID public health emergency period. We appreciate everybody joining us online today. We hope everybody is safe and healthy. We do recognize, because we work in the healthcare industry, that this is an extremely difficult time, particularly for our constituents in the healthcare industry. And we recognize the challenges that everyone is facing. For those of you who are dealing with sick family members or simply trying to adapt to working and watching small children at the same time, we thank you for being here and taking time out this morning. Congress did act swiftly to enact the waivers to allow for widespread telehealth adoption during the public health emergency period. And we have seen the positive impact of telehealth across the nation. I want to be clear that these waivers have allowed those for whom regular office visits are not always possible to access the system during the pandemic. So what does that mean? You may think that this just means that people who are dealing with COVID-19 or coronavirus are suddenly getting telehealth visits. And they are. Individuals who are suffering from COVID-related symptoms or recovering are able to get treatment and services through telehealth and COVID-related issues virtually. But in addition to doing that, this waiver fulfills another really important function. It's expanded access to thousands who are dealing with COVID-19, but also it's allowed individuals to manage their non-COVID-related treatments. People who need chemotherapy, cancer treatment, diabetes care, heart disease, mental health care. This waiver has provided access to millions of people who cannot get to the doctor's office because it's not safe, or because they're a single mother, or they have an essential job that doesn't allow them time off. It's helping those with health disparities, veterans, anyone who needs critical care that needs to happen. This is helping to keep United States citizens healthy. The issue is that these waivers are temporary and will expire if Congress does not pass legislation, and it will have a detrimental impact if it expires, to the point where we refer to this as actually falling off a cliff. All of that access is at risk of disappearing unless we take action now. Which is why I'm so thrilled that we're joined this morning by leaders of the Congressional Caucus on Telehealth who do want to take action. Representatives Mike Thompson and Doris Matsui from California, Representative David Schweikert from Arizona, Representative Bill Johnson from Ohio, and Representative Peter Welch from Vermont, who last week introduced the Protecting Access to Post-COVID-19 Telehealth Act of 2020. Which will ensure continued Medicare reimbursement of telehealth services. This morning, we're going to hear from representatives about the legislation and the importance of telehealth, and then we'll have a panel with the CEOs of the sponsoring organizations that I mentioned, as well as a call to action with details for how you and your organization can help support this legislation, which is vital. I want to thank everybody who submitted questions in advance, and we will have Q&A before we wrap up today. But first, I want to turn it over to the representative who actually sponsored this bill. Representative Thompson is going to kick us off this morning and talk a little bit about it. So welcome. Thank you for joining us.
Well, Jen, thank you, and thanks for the nice introduction, and thanks to all the sponsoring organizations who have come together today to make sure that this happens. And a very special thank you to all of my colleagues who are not only on the call, but have just been doing great work on this topic for a long time now. It would not have happened, we would not have made the progress we've made had it not been for this great group of bipartisan members of Congress working together. And we really have seen some progress over the course of just the last 6 months. And I have a couple of examples in my district. One provider in my district went from providing about 300 telehealth visits per month to 3,000. And that was just for mental health patients. And I have another hospital that went from less than 1% telehealth visits to over 60% telehealth visits. And I'm sure that all of us could give a ton of examples of how telehealth has increased access, saved lives, and saved money. So it's a pretty exciting time for telehealth. And that's why we're not only working on these things together, but we've introduced this new legislation. And our bill would make a lot of telehealth expansion permanent. It would eliminate requirements that folks be in rural areas to get care, and it would allow seniors to be able to get care from home. It would make permanent the care at FQHCs and ensure that we can expand telehealth in future disasters. It would be the most sweeping expansion of telehealth ever. There's a lot of enthusiasm right now for doing this. We have the director, administrator over at Medicare, Medicaid, Senators Wyden and Grassley, and many of the leaders have said that they want to make the things that we've already done in the COVID legislation permanent. And I think I can speak for all of us. We agree that this needs to be done, and that's why we have this legislation. The one hitch is the CBO scores, and they are off the charts. And there's some important questions that still need to be asked. For example, telehealth must be accessible to everyone. Right now it isn't, as you all know. You need broadband, and you need to be able to afford to use the technology that's required in making sure we roll out telehealth. And we can't allow telehealth to leave anyone behind. We need to use telehealth to reduce disparities, not to expand disparities. So as we work through these questions and collect more data showing the benefits of telehealth, we made sure in this legislation to offer some more moderate short-term principles, such as ensuring that HHS can expand telehealth in future disasters, not just in COVID, and extending telehealth for 90 days beyond COVID to make sure that there isn't an abrupt end of service for seniors who are getting so much benefit from what we've done in this temporary environment. And primarily giving some of the areas where we know there's going to be additional problems, such as the fire problems. We've had ongoing red flag warnings in California with the high winds and the tremendous fuel load. It's really critical that telehealth expansion be available for all future disasters, be it fire, COVID, earthquakes, mudslides, floods, whatever it might be. We'll continue to push this over the coming weeks and months. We have another COVID package coming, and there's also a spending bill that's coming due. So we've got a lot of opportunities to try and get our oar in the water. And we appreciate working with you, and we'll continue to do our work, and we hope we can continue to be successful. So thanks again for having me, and thanks again to all of my colleagues who've done such great work on this.
Thank you so much for your leadership. We appreciate it.
Thank you.
All right, let's go to Representative Schweikert next. Good morning. Thank you.
Yeah, good morning. And as always, Thompson took all the obvious points away from us.
You've got your chart, right?
Don't laugh. We actually thought about trying to do one.
Oh, I know.
But actually, there's a point my friend from California was making, and I want to expand upon it. For all of you who actually help provide telemedicine services, can you help us have data and information and unit costs? Because we really have to start to understand our cost and how we score this. Many of us have a concern that as CBO and others try to figure out what its cost is, we're actually sort of groping in the dark. Because if you actually sort of build a little flow chart, you would make an assumption that this would save money. When you actually add up an elderly individual who needs transportation services, the ability to move to and fro the doctor's office, can that service be provided through telemedicine? Well, what was the total cost of that visit? And so if you can help us build information in a model, and we also, by doing that, you can help us build the argument for permanency. And also, what does the next generation of telemedicine look like? Is it just the ability to make a phone call or have a FaceTime with a medical professional? Is it also the thing you wear in your wrist that's helping monitor your vital signs, that's being interpreted by a medical professional and an algorithm? And that's, so there's a brave new world here. And for all of you in the association, for my fellow members, there's a lot of folks in the healthcare delivery industry that this disruption is a bit of a threat to the business model. Help us sort of understand, are we doing the right thing? How do we make it cost effective? How do we make it compassionate and loving to help people that need it? And then we'll work on other solutions of how do we make sure that everyone in our society has accessibility. So this is more than us just telling you about our legislation we're working on. We now need feedback of how it's working during the pandemic so we can build what the future looks like.
Great, thank you so much. And I know all of our organizations have lots of data about the positive impact that we would be delighted to share with you. So thank you, we will do that. Let's go next to Congresswoman Doris Matsui. Welcome. There you go.
Hi, everyone. I want to start by thanking my Telehealth Caucus colleagues for your work on this important bill, and a big thank you to our hosting organizations for setting us up on this virtual rally today to talk about COVID, telehealth, and our new bill. To all the stakeholders on the line this morning, your support continues to be absolutely critical to ensure that we capture the successes in telehealth we've seen during the pandemic, to secure broader, more flexible telehealth policies that support the expanded use of digital care in the long run. And along with many of my colleagues you've heard from today, we've been working on these issues for a long time. And as many of you know and have experienced firsthand, it's not been easy to grow technology's role in healthcare delivery. Up to this point, due to cost concerns alone, we've had to take a real incremental step-by-step approach to opening up telehealth reimbursement to provide seniors and those on Medicare access to telehealth services wherever they are located. We've had some successes doing things in that way. Last Congress, my friend, Representative Bill Johnson, and I prevailed in getting our telehealth legislation for substance use disorders included in the SUPPORT Act. We're now on our way to expand telehealth opportunities for mental health providers with a telemental health bill having been favorably reported out from the Energy and Commerce Committee last week. We've seen similar advancements for stroke and dialysis by waiving geographic restrictions on telehealth for these services and adding the senior's home as an originating site. But this hasn't been enough. My Telehealth Caucus colleagues and I recognize that, and that's why we introduced the Connect Act for Health Act last year, because we want to expand telehealth coverage in the Medicare program in a way that will spur increased investment and innovation in delivery redesign to benefit all patients. In 2020, the COVID-19 pandemic and providers engaged in healthcare delivery. Telehealth has proven vital to preserving the continuity of care. The waivers during the emergency have been critical to supporting the uptake of digital care, and now we must act to make these pro-telehealth policies permanent. And that's why we've regrouped to introduce our COVID telehealth bill. After this public health emergency, this legislation will ensure that we keep moving forward on telehealth, letting seniors in all areas continue to use telehealth to access the care they need from a distance and in a setting that they are comfortable with. For my constituents in Sacramento, who've long been shut out from telehealth opportunities because they reside in an urban area, our provision to permanently waive Medicare geographic site restrictions to allow for telehealth services in both rural and urban areas is absolutely essential for maintaining and improving access to care. You know, our world is changing, and we must continue to explore and support innovative solutions to enhance access to healthcare, improve connectivity, and ensure all patients can benefit from telehealth. But the time is now to waive out dated and inequitable restrictions that do not meet our mission and vision for 21st century healthcare system. I thank you all for your support and enthusiasm of our efforts and look forward to working together as we take our biggest steps yet to make telehealth a broader and more permanent part of the Medicare program. And I thank all of you for being here today, in particular my colleagues and all the panelists. Thank you so much.
Thank you. We really appreciate your leadership on this issue and appreciate you joining us today. Next, we're going to go to Representative Johnson, and then we will go to Representative Welch. Good morning.
Well, thanks. And it's good to be here with you today. I'll try to make this short and not repeat what you've already heard from some of my fellow colleagues and Telehealth Caucus co-chairs. I'm really proud to work with these folks because we've been working, as Congresswoman Matsui just said, we've been working for years on this issue. And while we all knew that telehealth was the way of the future and that patients and providers would be pleased with its expansion, it's a strange turn of fate that it took a silver lining in a very dark cloud of a global pandemic for people all over this country to wake up. You know, by this point, we've all heard from patients and providers how extremely pleased they are with the temporary waivers that we all pushed on the Telehealth Caucus, the burdensome red tape and the restrictions that came down that enable them to get care at home without having to get out and get to a hospital. I want to give a perspective for you all from a district like mine, a very rural district, on why this hits so close to home. During COVID-19, Americans seeking their regular doctor's appointment or mental health care were in many cases either too fearful or unable to go to the doctor to receive that care. They were told by their providers, don't come here because you risk contracting the virus. We heard from countless doctors that these types of interruptions can have devastating consequences on patients, particularly those with mental health disorders and those going through opioid recovery and those kinds of things. But for a rural district like mine, even in normal times, many people don't have access to this kind of capability, including the elderly or the disabled who can't drive, or they can't find a local loved one to take them to see a specialist like a mental health provider who in many cases might be hours away. So this is why telehealth is so very, very important. And speaking more broadly about COVID-19, although it didn't create the urban rural digital divide, it has certainly highlighted the fact that in today, the 21st century, access to high-speed internet is as important as access to plumbing and electricity are to quality of life and opportunity. And it certainly highlighted the fact that Congress still has an enormous amount of work to do to address that. They don't have in rural America adequate connectivity to broadband. And the pandemic brought this into sharp contrast, with many Americans realizing that they can't work from home. They can't set up their kids for distance learning, and they can't take advantage of telehealth options with their doctor. Expanding broadband goes hand in hand with what we're talking about today. You can't have robust telehealth across America unless you've got robust access to high-speed internet. Let me give you an example. I had a provider contact me during the early stages of the pandemic. And he said, Bill, I got a real problem. He said, I have a fiber connection. My internet service provider has a fiber connection at the pole outside my driveway. But because of this pandemic, they will not come in and connect that fiber so I can have high-speed access to the internet. I am a cancer specialist. I'm an oncologist, and I treat some of the most vulnerable patients in the world. Patients that are undergoing chemotherapy are at tremendous high risk. They can die within a matter of hours if they contract this virus, not days or weeks, literally hours. And we've seen instances where that is the case. So I got on the telephone and I reached out to this internet service provider and I said, wait a minute, aren't you guys an essential business? Well, yes, we are. I said, aren't you going into hospitals and healthcare facilities maintaining that high-speed internet for those facilities? Well, yes, we are. I said, then you tell me how it is a higher risk of you contracting the coronavirus by sending your workers into a doctor's house, his home, a doctor that has not even been out of his home and hasn't even been exposed to COVID, in order to protect and provide this telehealth service for people that need it. It is unbelievable to me. It took us over a month to convince that internet service provider that they had not only a responsibility, but they had the moral responsibility to go in as an essential business and connect up that doctor. It should not have taken that kind of interaction between a member of Congress and an internet service provider to provide that kind of support. So we've got to solve this problem of high-speed internet, because it directly correlates to the ability for us to use telehealth to its maximum potential. So I really appreciate my colleagues that are here today, and I know that they are passionate about this because I work with them every day. I want to especially thank the eHealth Initiative and all of you folks for putting this together today. And I look forward to helping us have a telehealth moment, if you want to call it that, where the rest of the nation now understands just how vitally important this technology is and the value that it brings to providing high quality health care, access to high quality health care at a reduced cost all across our country. So over to the rest of you. Thanks for having me today.
Congressman Johnson, thank you so much for your comments, and we really appreciate you shining a light on those health disparity issues and the issues with rural health. It's so important, and I know that my colleagues here today, Hal Wolf with HIMSS, and Mon Johnson with ACA, Krista Droback with ACC, and Joel White with HIA. We've got lots of examples of how this is working in the field as well, and we would be delighted to support you however we can. So thank you. We appreciate your leadership on this. All right, now we're going to go to Representative Welch. Good morning. Thanks for joining us.
Thank you. It's good to see you. It's good to see my colleagues, and it's good to be with a group of people that are all on the same page about doing something good and doing it as quickly as we can. Just a couple of points, because I really endorse all the comments that my colleagues have made. But one of the questions about telehealth, aside from the cost and the technology, was what's the quality of the interaction? And what I've been hearing from Vermonters, both the providers and also the patients, the users of the internet, is that in many cases, they saw the intimacy of that interaction being even more substantial than the effort that's required to get up out of your house, to drive to the oftentimes big facility, to go through the waiting line, to sit in the waiting room, and then for the doctor who's seeing you to be oftentimes pressured to do all that data entry that has to happen as you're sitting there. And both doctors and patients have expressed to me that the focus that is direct actually feels even more intimate oftentimes than the effort and involvement of going into a doctor's office. So the quality of it was a concern. And even in mental health, in talking to some mental health providers, they're talking to that person in their home, and they can talk to the husband or the wife or the partner and get some additional details and become sort of part of that family to try to help create that confidence that people need to make that next step. So the intimacy issue, I think that aspect of it is a real upside. Obviously, the convenience is enormous. And the resistance, I think, had a lot to do with an expectation that it would be, quote, abused. And really, there's no legitimate, that's not a legitimate argument. It's a legitimate concern. But abuse can happen in any way that a service is provided. So the goal there is to make certain that we've got guardrails and we do it right and there's accountability. But the fact that it's convenient for the provider, really convenient for the patient, that there's an intimate interaction, that in many cases the appointments tend to start on time much more regularly than when you have an office visit. So that intimacy, I think, is something that we should keep reminding has proven itself. Then the other point, I think Bill Johnson just really laid out why all of us who are for telehealth have to be for high-speed internet across the country. I mean, rural America is being left behind. COVID really showed that. If you don't have high-speed internet, it's not a question of can your kids do their homework. The question is, can they go to school? And they can't without high-speed internet. It's not a matter of whether you can do work after supper because we're all working hard. It's like, can you work at all? And you can't without high-speed internet. And now, of course, medical access requires high-speed internet. So I do think, and I know all of us on this call believe this, all my colleagues, we absolutely have to do now what Congress did in the 30s when it said that we are going to electrify all of America. Electricity is essential. And there wasn't an economic argument to bring electricity to a farm on a dirt road in Victory, Vermont. But there was a social case to be made. And the social case here is rural America has a lot to offer. It can't be left behind. And internet is as essential as electricity. So that's got to be part of our push. So thank you all very much. It's wonderful to be with my colleagues and to continue to participate with them in trying to get this telehealth expanded so access is improved all across America. Thank you.
Thank you so much, Representative Welch. We're so delighted that all of you were able to join us this morning, and we appreciate your leadership. I think, as Congressman Johnson said, we think we're having a telehealth moment right now. So we want to support you as best we can in that effort. I do want to turn it over to my colleague, Ann Johnson, the CEO of the ATA, who's had such a leadership on this issue for years and just been an incredible supporter of your efforts. And Ann, I know you wanted to make some comments on the importance of the geographic restrictions around telehealth and what's happening. Thank you.
Right. Thank you so much, Jen. And thank you, Representatives Thompson, Johnson, Welch, Schweikert, and Matsui for your bipartisan leadership advancing telehealth policies. Telehealth has been a major policy issue in recent months because the new flexibilities afforded by Congress and the administration ensured more Americans were able to receive needed health care using telehealth. And yet telehealth is not new. The five of you, these members of Congress, have been fighting for common sense telehealth policies at the federal level for years. So thank you for your leadership on this important issue. The American Telemedicine Association is proud to support this bipartisan telehealth caucus and their recently introduced legislation. We're proud that the organizations here today have joined us in support. The ATA's vision is to ensure that people get care where and when they need it, while enabling clinicians to do more good for more people. We know telehealth can help transform our healthcare system by providing greater access to safe, appropriate, and cost-effective services. Today, I'm especially glad to talk about the importance of this point, that patients should access care when and where they need it. This means if a patient lives in an urban, rural, or suburban setting, they should have the choice of telehealth. For too long, federal statute has maintained that telehealth is only useful to patients in certain geographic areas. This is one of the biggest arbitrary barriers within 1834M of the Social Security Act, and it is something all our organizations believe should be fixed. This statutory restriction is not evidence-based. Instead, it is discriminatory in nature, allowing one population of Medicare beneficiaries to access a service while categorically excluding another. In fact, CMS has stated that urban beneficiaries experience barriers to care and that telehealth can help overcome these barriers for both urban and rural patients. As such, federal policy should not restrict the provision of care based on an arbitrary criterion like a patient's geographic location. One of the ATA's core policy principles is to expand access for underserved and at-risk populations. To truly reach the patients who need care and to address the healthcare disparities that have been exacerbated during the current pandemic, we must ensure all patients have access to safe, quality care and that we do not create new disparities by limiting care based on a patient's location. The organizations on the call today recently achieved something extraordinary. 340 stakeholders were united in support of a specific set of policy priorities to ensure telehealth continues to be an option for Medicare beneficiaries post-pandemic. Removal of the geographic restrictions in the telehealth statute was one of those priorities, and I am proud to say it is one of the biggest policy priorities of the ATA. During the public health emergency, we've been appreciative that Congress allowed the Secretary of HHS to waive restrictions found in law, like the requirement that a patient be in a specific geographic area. Medicare beneficiaries and providers have responded, and they have used telehealth regardless of where they live, and research shows they like using it. We cannot let patients go over the telehealth cliff when the public health emergency expires. We must act now to fix the geographic issue once and for all by removing it from the books. Telehealth Caucus, we thank you for taking the ATA's priorities into consideration as you drafted the legislation we are discussing today. We look forward to working with you to ensure passage of this important legislation going forward. Thank you.
Thanks, Ann. Next, I'm going to turn it over to Joel White, who's the Executive Director of HIA. I think many of you know Joel and has been working hard on these issues on Capitol Hill. Joel.
Thank you very much, and thanks to everyone on the call, and especially to the members of the Congressional Telehealth Caucus. I think this bipartisan bill is excellent, and hopefully we get it signed into law sooner rather than later, because I do think we're having our telehealth moment. I think since March, most of the country has been locked down. No surprise to anyone, but most people are staying at home except for some limited trips to grocery stores, pharmacies, etc. But really, for those who need care, those who have chronic illnesses, which is almost half the population, in Medicare, it's much more, many more people. Access could really have been severely restricted, and it could have put many more people at risk of worsening conditions had telemedicine not been there. And the other thing I think that's important to note is that if care at the home wasn't available via telehealth, many more people would be at risk of infection, or if they were infected, going to an office, a physician office, or to a hospital as an originating site for care to receive maybe routine care for their illness. They were risking infecting other people. And so it was really smart that CMS, through their regulatory authority, temporarily expanded access to telehealth services in the home. Effective on March 6, 2020, and for the duration of the emergency, Medicare is making payment for Medicare telehealth services furnished to patients in the home setting. These visits are considered the same as in-person visits, and they're paid at the same rate as regular in-person visits. And that's a waiver of a long-standing restriction in fee-for-service Medicare. Almost 15 years ago, when I was on Capitol Hill working for the Ways and Means Committee, trying to figure out the restrictions around telehealth in the Medicare program and how we could expand access. This was one of the main ones. And so I think that CMS lifting this restriction temporarily was an important first step. But we really need this bill to add the home as an originating site for telehealth. And it would do that. It would start in January 1st, 2021. People could access the telehealth services in their home as an originating site. And that's really important in the middle of an infectious disease pandemic. But it's important even beyond that, because for folks with Parkinson's, mobility disorders, arthritis, MS, it's hard for them to get to the doctor. And so for routine care, for those visits that can be delivered in the home, it's pretty important. So why is it important? Fewer infections, fewer deaths. I think we'll see less cost through lower ER visits and hospitalizations. There's one study, 30% of ED visits for patients with common chronic conditions are preventable. So if we can prevent those 30% of those ER visits, we'd save maybe $8.3 billion in costs every year. Part of that, of those visits to the ER, because people lack access to primary care and testing. And so there's studies on this. Congressman Schweikert talked about the data that we need to collect. We're doing that. We can show that this is saving money, and it's resulting in better access at the same time. So it's really important to do this. Employers do this. They provide coverage in the home. The VA does it. Medicare doesn't because of the law. And that's why we need to change it. We need to everyone to endorse the legislation, HR 7663. Contact your representative. We're circulating a letter to sign on. But now is the time. We're having our telehealth moment. Now is the time to make sure that we get this done. And just want to thank all the members on this call for being so proactive and so energetic and such advocates. We're trying to get this finally taken care of.
Great. Thanks, Joel. Okay, Hal Wolf, the CEO of HIMSS. Welcome.
Let me make sure I unmute, and thank you so much, Jen. Good morning. I am Hal Wolf, President and CEO of the Healthcare Information and Management Systems Society, or HIMSS. First of all, I'd like to personally thank Representatives Thompson and the members of the Congressional Telehealth Caucus for their leadership championing telehealth issues and for introducing the Protecting Access to COVID-19 Telehealth Act of 2020. HIMSS, through our 80,000 plus members across the US and the world, is a global thought leader on a mission to reform the global health ecosystem through the power of information and technology. And our vision is to realize the full health potential of every human everywhere. As we look ahead to what's next in healthcare, solidifying the role of telehealth will play in healthcare delivery is critical. Telehealth can be a great equalizer in the access to many types of quality care for patients, regardless of where they're located. We often refer to this as geographic displacement, and as Ann noted earlier, this is both a rural and urban challenge. As the U.S. has grappled with the providing of healthcare services during the pandemic, telehealth's taken on new importance. And the congressional authorization in the CARES Act to permit rural health clinics and federally qualified health centers, RHCs and FQHCs, to furnish distant site telehealth services to Medicare beneficiaries during the COVID-19 public health emergency had an immediate and positive impact, providing invaluable tools and support for RHCs and FQHCs to safely treat their patients. That's why it's so critical that Section 3 to the Protecting Access to Post-COVID-19 Telehealth Act of 2020 would codify this important change, permanently making RHCs and FQHCs eligible as distant site providers to offer vital telehealth services to their patients, whether they're in our largest cities or our most rural communities. Lifting these archaic restrictions will have a profound impact on health and wellness for all communities, giving consumers who face obstacles to clinic visits a way to access care despite bus routes, unforgiving work schedules, family accountabilities, and other challenges. Now, look, we've all known that underserviced communities have consistently lacked reliable access to critical primary care services. And that lack of access has been magnified and laid bare as our nation has tried to contain the spread of COVID-19. RHCs and FQHCs share a patient population that often have faced significant challenges in accessing care. Whether it's a 2-hour drive across the desert or sitting buses stalled in city traffic, alleviating just one of these burdens from the lives of patients can significantly increase their chances that they will receive the care they need. We must remember that a 20-minute visit for a patient can be, from a clinician point of view, can be an all-day affair for an individual, from a patient, and often family members that need to accompany them. And it's been remarkable to see how COVID-19 telehealth flexibility has led to a transformational opportunity for the underserved. Now, Unity Health is a 2-time HIMSS Davies Award recipient, which celebrates innovation leaders in digital health. It's an FQHC in Washington, D.C., operating in the shadow of the U.S. Capitol, with a patient population that is largely African American and Hispanic, low income, and about 10% homeless. By mid-March, without telehealth available, total visits dropped to 1/3 of the normal rate. However, when COVID-19 telehealth waivers went into effect, Unity Health was able to rapidly scale, going from 0 telehealth visits to 800 daily within 30 days, and is now seeing nearly 1,000 patients per day via telehealth. Similarly, WellSpan, a large integrated healthcare system in central Pennsylvania, was able to scale up from 223 remote visits during the first week of March to over 20,000 weekly visits in April, including video, phone, and e-visits. No longer is access to the best specialists limited to those who can pay a premium, living in high rises in cities, or able to jet from country to country to seek the best care. The embrace of mobile technology also means that rural and low-income patients are no longer automatically included. And this is on top of the high-speed internet. But the access to mobile technology is critical. 71% of US adults earning less than $30,000 per year own a smartphone. And in 2017, survey of homeless Americans showed that even 93.6% owned a cell phone of some type, and 58% owned a smartphone. CMS Administrator Verma recently noted that 1/4 to 1/3 of Medicare beneficiaries, equally across all age and ethnic groups, receive telehealth services during COVID-19. And we must allow health centers and providers to meet their patients where they already are. The sad truth is that physicians, especially primary care physicians, are not being produced at a fast enough rate to keep up with the growing demand inside the United States. In the US, the recent Association of Medical Colleges studies predicted that we have a physician shortage of anywhere from 46,000 to 122,000 by the year 2032. This fundamentally puts in jeopardy our classic encounter paradigm. As the US, and across the globe for that matter, braces for the impact of our physician shortage, communities that particularly rely on RHCs and FQHCs will continue to bear the brunt. Telehealth will play a critical role in these communities, and we simply cannot go back. We must continue to move forward to ensure access to quality care. Regarding the PHE telehealth waiver, the last great policy change this bill would accomplish is making permanent the secretarial authority to waive and modify applications of telehealth requirements during any future emergency period declared by the president or the HHS secretary, while sunsetting those waivers 90 days after the end of the emergency, thus giving providers relief from the sudden loss of any services. As we've seen from the healthcare system's rapid and dramatic adoption of telehealth during this COVID-19 public health emergency, to maintain access to care, continue management of a patient's chronic conditions, and safely monitor COVID-19 patients, the importance of permitting the Secretary to waive a wide range of telehealth rules and restrictions, which we should all respectfully challenge, for a public health emergencies is invaluable, and it has truly been a lifeline for patients. The provision is a vital part of building resilience into healthcare. Finally, we should recognize that technology is really not the biggest barrier here from the clinician point of view. From the smallest health centers to the largest hospitals, we are seeing the fruits of our investment in building out the healthcare infrastructure that was spurred on by Congress, and it allowed us to pivot to digital health. As our country embraces the many benefits of telehealth and connected health technologies and services, it's simply time for our policies to catch up. Thank you.
Thanks so much, Hal. Those are really great examples. Krista Drobak with ACC. Oh, did we just lose Krista? I think you're on mute.
Sorry about that. I'm Krista Drobak. I'm the Executive Director of the Alliance for Connected Care. So glad that we have so many of you on today. So this is a rally. So I'm bringing up the rear here, and I'm going to try to rally everyone on the brass tacks things that we need to do to get this done. So I think the number one thing is that we need to work together. We've seen a lot of niche bills come out recently, and I think this bill that we're talking about today represents broad-based change that will help all of us. So our hope is that we don't offer those that might not want to push the envelope as far as it should go. We don't want to offer them necessarily an opportunity to pass small bills. We think we've got an unprecedented opportunity here to go big. So we hope that we all can work together to go big. We also just saw some temporary changes in the new Senate White House compromise. it would be great if we could push for permanent change, and this bill will do that. So I guess that's just a call to all work together, and all of the groups here are setting an example of how we can work together. The second is you heard Congressman Schweikert talk about data collection. Really, really important to collect data. We, the ATA, the Alliance for Connected Care, the NCQA launched a task force, and we have a few subgroups, and one is on cost. And the subgroup has been collecting data among providers, vendors, hospital systems to demonstrate that the overall utilization has not gone up. So we have charts from various providers that show the exponential increase in telehealth during the early quarantine in the spring. But if you look at the overall trend lines, there wasn't an overall increase in utilization. And we've seen that across multiple systems. So we're trying to collect as many of those kinds of graphs as we can to bring to CBO and to bring to Congress and MedPAC and OMB and CMS. So anyone who's interested in looking at their internal data, we can send you an example of a chart that we've been using that that shows the trend line. So sort of we want to make these charts easy and digestible and comparable. So again, reach out to me or Chris Adamek, who is on the line today from the Alliance for Connected Care. If we can, we'd like to break down as much data as possible by geography and demographics. You've heard many of the speakers today talk about the various populations, rural populations, minority populations, intercity populations. We want to look at the differences in the impact of telehealth on all of those populations, because we may need specific policy related to helping all Americans access telehealth. So it's important to know, kind of dig a little bit deeper into that data. But all of this data combined is going to help us convince CBO that this bill is doable and is not going to cost the federal government an unnecessary amount of money. So the data collection is really key. Patient stories, also very key. You know, we've been collecting anecdotal stories as much as possible, but they do make a big difference. They really influence people's thinking about how telehealth can be integrated into the healthcare system for the long term. What we're legislating here is really long-term policy. It's not more emergency policy. It's long-term, how do we integrate telehealth? And hearing stories from seniors about saved time that they've spent in the car, or the ability to have a doctor's appointment when they are homebound, for example. So any of those stories are really helpful. I would actually add that caregiver stories, I think, also would be good. There's a real focus, as you know, among many constituencies on caregivers. So I know that telehealth is really making the lives of caregivers easier, because they are can easily participate in medical appointments. They can more easily understand when the folks that they're caring for are checking in with their doctors and what they're saying. So, so I would say also caregiver stories. Mobilize members of Congress. We need to mobilize people in your districts, and that's what's going to mobilize more members of Congress to get on this bill and co-sponsor this bill. We need to raise awareness of the bill. Again, many members are introducing their own bills, and we'd like to make this a consensus piece of legislation, given how broad-based it is. So for those of you who have member association state chapters, please send out, you know, in your newsletters a call to action to call their or their senator and get them to sign on to the House bill. Hopefully we'll have a Senate companion. So again, mobilize your own members in their own districts. Need co-sponsors of the bill. Next, sign the letter of endorsement. You'll be getting an email. Some of you will be getting it from Catherine Pugh, others from Chris Adamek, with a link to the letter. We want to get as many signatures endorsing this bill as possible. For those of you who are advocating for other bills, there's no reason why we can't be on two. So we're hopeful that we can have a really long list. You know, this group that's on this call today organized the letter that went to Congress with 340 stakeholders, and this bill is in part a result of that. So sign-on letters really do work, and we'll hope that you'll consider signing on. And then we're also having a town hall meeting for the task force that I just mentioned earlier with ATA and NCQA. It would be great if you could participate in the town hall. We received more than 350 responses to our request for information, and those responses have been invaluable in coming up with ideas around fraud and abuse, cost, and quality. Those are really the three things that we have got to answer for members of Congress as they look to make this permanent. I've heard, and I'll just wrap up by saying, throughout this time period, I've heard variations of you can't put the toothpaste back in the tube or the genie back in the bottle, or on and on. I've heard those metaphors, but honestly, we've got to show answers for fraud and abuse, cost, and quality, because it isn't just a political issue, and it isn't just members of Congress not wanting to take a benefit away from seniors. It is about how we're preserving and using taxpayer dollars well, and avoiding fraud and abuse. So this is going to be not an easy task, and we got to all work together and collect the data and evidence. So I'll turn it back over to Jen. Thank you.
Thanks so much, Krista. And really great points there about the caregiver stories and fraud and abuse. And I think what your organization, the task force, is doing, that's really tremendous. So maybe we can send out some of that information as well. So I just want to draw everyone's attention to what Krista was just talking about on the screen there, the call to action that we need your help. There is a stakeholder letter there we'd love for you to sign on to, and we're going to send that link out again just to reiterate that. We've gotten several questions in from registrants, so I'm going to go through some of those now, and they reflect some of the comments that we're seeing in the chat box as well. So Anne, a lot of people have been asking about broadband, the availability of telehealth in rural areas, is there enough support there? Can you speak to that a little bit? That is a huge issue, and talk about how that impacts telehealth and what needs to happen there with broadband.
Well, I think our congressional representatives touched on many of these issues already. You can have great technology, but if you can't connect, it's not going to lead to better health for anyone. So I think that we're really supportive of activities and many of the projects that are and pilots that are being funded by FCC in regard to broadband utilization. So we expect this to be addressed, but we also expect that it will cover both urban and rural areas. That's our hope, because again, there are medical deserts all over the US. So very supportive of these measures. And I love the notion that having access to internet is almost a social good.
Yeah, that's a great point. Hal, do you want to comment on that, given your comments on health disparities and how broadband impacts those populations as well?
Yeah, my sense of it is that you've really got two ends of the spectrum. One is the clinician, who really needs to have a higher bandwidth just for access to the data records, whether they're accumulating it over HIE from a transport standpoint, whether they're looking inside their own EMR. There's a number of ways that information's got to be accumulated. But when they reach out to an individual patient, there is some flexibility there. You can use a mobile device, a handheld device. You can make it a little more lightweight. So, talking to you from rural Colorado, and I have to use a microwave link in order to tap into a virtual backbone to get to 8 megabits per second in the transport for this video, which, by the way, is, tiny compared to what I have in our house in Denver, which is literally at 150 megabits per second. The reality is I can do a lot over my phone. I can do a lot through a mobile device. So I just think that we don't need to look at so much as an inhibitor. It's an opportunity with broadband itself. But what we can do over mobile devices can be extremely beneficial in the use of telehealth. And this is extraordinarily important. I noted in there about the number of homeless that actually carry mobile devices as well. The cost of entry is relatively low, but the access is worth its weight in gold. And we shouldn't let what is a very important initiative, and I thought he nailed it when Representative Welch was talking about the parallel the electrification of the United States in the 1930s to the broadband outreach. And by the way, I can't get my broadband provider who's a quarter mile down the road to come up to my house, which is why I have to use this archaic system. So that's the main point I was trying to get across. Last point that I would simply make from a U.S. standpoint and beyond U.S., I've had the privilege of designing and implementing a number of mobile health platforms that are extraordinarily lightweight. And so we just need to think outside the box in the United States. We can get capabilities in every single citizen's hands, an individual's hands, as quickly as possible.
Jen, could I add something?
Yeah, please.
Today, Representative Abigail Spamberger, Democrat from Virginia, and Dusty Johnson, a Republican from South Dakota, are introducing or releasing a letter calling on the FCC to provide greater certainty and support for healthcare providers in telehealth. And they also are introducing legislation that will add another $200 million to the FCC fund that was created in one of the stimulus bills. So as you know, that $200 million is already gone. So they want to add another $200 million that will help people with the broadband access piece of this. So just encourage folks to take a look at that bill.
Yeah, and Krista, if I may, your point is spot on, right? You got to start with the provider first and foremost, and then whatever we can extend beyond that into individual homes is a huge benefit.
Joel, do you want to comment on that? Because there has been a lot of legislation around broadband, and if you could just comment on kind of the limits of that and how far that's gone.
Well, I think that, there was some mention about how this is really like a rural electricity program, and getting people linked up is more about a necessity in an information economy. I'd note that the HEROES Act that passed the House, part of that package included several $1 billion for additional broadband funding, and there's some effort in the appropriations bill process, the regular funding process of the government to provide tens of billions of dollars in broadband funding. And so I think that, if telehealth we're having a telehealth moment, I think we're having a broadband moment at the same time. And I think you can't have one work well without the other, and they go hand in glove. And so we've long supported enhanced funding. I think if we can get 100% coverage in the country for wireless high-speed broadband or connected broadband, that would be a massive step forward. It will benefit not just schools and connectivity in that regard. It will greatly help healthcare and ensuring our providers are connecting with patients in their homes. I think that'll be ultimately a part of the package in the COVID package. There'll be funding, and I also think at the end of the year, regular appropriations funding of the government in September, there'll be a provision in there providing some additional funds as well.
So broadband is clearly one of the biggest challenges in terms of adopting, widespread virtual care. We also heard a lot initially about there being pushback potentially from providers about virtual care. Krista, I was hoping you could comment on this a little bit, because you talked about this in your caregiver stories and actually kind of the positive impact that's happened with virtual care. Could you talk a little bit about the challenge of provider adoption and actually how well providers have adopted some of this telehealth technology?
Yeah, just like the stories that you heard from others, the members of the Alliance for Connected Care have seen just unbelievable growth. I mean, Intermountain Health was doing 100 visits a week in January. Now they're at 50,000. I mean, I could go on and on. That story is replicated everywhere. Now that some states have been reopening, we're seeing more of a mix of telehealth and in-person visits. And again, again, I think there hasn't been a necessarily an increase in utilization. It's just a mix of virtual and in-person that is changing. What in things that are impacting provider adoption beyond broadband is a big one is uncertainty around whether or not these policies will become permanent. I have heard that so many times, and so you know, I do worry a little bit about the language that was just released from the Senate GOP and the White House, extending the flexibilities until the end of next year. I understand that, the desire to do that, but I worry for a couple of reasons. One is it just extends that uncertainty. If you're a provider office, why are you going to invest in changing the workflow, educating your patients on the value of telehealth and how you know, how they can have telehealth through your office, doing all that work, not knowing if this is going to end in the end of 2021. So I urge all of us to be hesitant and skeptical of temporary measures. I do believe provider adoption will increase if we make this permanent. I want to say one other thing. It's not just providers that are stymied by the temporary nature of all of this. The state of Virginia is writing a plan for telehealth for the state. What are they going to pursue as a state? And the publication of that report is being held up by whether or not the federal government is going to act on making this permanent, because that changes the state strategy completely. So I would say stakeholders across the spectrum, providers, patients, state actors, Medicaid programs, everybody is uncertain about what the future is and can't really plan for how we're going to be a healthcare system that integrates virtual in a post-COVID world without some certainty. So that's why this bill is so critical.
Great. Anne, do you want to comment a little bit more, just to piggyback on what Krista was talking about, how the uncertainty is really impacting the industry and what you're seeing and hearing from providers and folks?
Well, I think that what's been interesting in the data is that pre-COVID, we had a very flat use of telehealth, and then of course it spiked exponentially. What we're seeing now is past the spike, we're seeing a drop in telehealth usage, but it is not going back to where it was pre-pandemic. So there's still a significant amount of business that is being done virtually. And notwithstanding the uncertainty, I think we're seeing a lot of positives. For example, and it was noted by one of our attendees that no-show rates, for example, for many appointments has gone down. And that, in fact, we're seeing that there's a significant uptake in the use of mental health services because, again, appreciating pre-pandemic, there were insufficient resources or clinicians to address that population's need. And of course, the need is growing with the pandemic. So I think that notwithstanding some of the uncertainty, we're seeing people move ahead and just seizing the moment, if you will, and really working to provide and meet patients where they are, which is really what has happened a lot with this situation. And I find that very encouraging. Like others on the call, we have a diversity of membership and seeing widespread use of both synchronous as well as asynchronous modalities. And then, of course, remote monitoring has really taken off during the pandemic. So all around, lots of probably uncertainty, but lots of real innovation and call to action on the part of providers at the front line and consumers jumping in.
And I'm going to give you a second to just explain the difference between synchronous and asynchronous modalities for those who don't know.
So we are doing synchronous right now with this teleconference. And then people who are submitting questions to us on chat are asynchronous. So I think if you think of text messaging, for example, that is an asynchronous form of communication. And again, what we saw with the pandemic is that asynchronous really enabled delivery systems to respond to an overwhelming number of inquiries coming in from people who were frightened, who were alone, who didn't have an idea of what to do, and asynchronous services really rose to the challenge.
Great. Joel, I want to go back to something you were talking about earlier about allowing the home to be a Medicare or telehealth originating site. Can you talk a little bit about what that means, and what do you think the likelihood is of that happening, being allowed?
Sure. So the statute specifically says that Medicare will not pay for services that aren't furnished at an originating site. And an originating site does not include the beneficiary's home. So what the legislation does is it says, no, the home can be an originating site for reimbursement for services furnished via telehealth. So it basically opens up the home as a site of care, which makes sense. We have the technology. We hopefully will have 100% broadband coverage and the ability to deliver that care directly into the patient's home. It's one of the things that's really been missing for a very long time in the Medicare program. We know that employers do this. The typical example is a parent with a child wakes up in the middle of the night, doesn't know whether the child needs emergency care or maybe just has a bit of a tummy ache. The ability to access a pediatrician right then and there might save a trip to the urgent care center or the emergency room, which we know is far more costly. In the Medicare side of the equation, what we know is there are multiple examples from many institutions around the country where older people have foregone routine chronic illness care because they felt concerned about being infected at an originating site, whether that was a physician office or a hospital. Now, the flexibility that CMS provided meant that if the senior knew about the availability of that care, they got it in the home. And what we want to do is continue that post-pandemic to ensure that Medicare beneficiaries continue to receive care in the home, not unrelated to COVID. I think the likelihood of that is pretty good, best we've ever had. I think it's dependent on how many groups on this call and otherwise really mobilize, sign on to the letter, endorse the bill, get up on the Hill and virtually, of course, and weigh in with their member of Congress to say, we need this change now. It's just so backwards the way we do it in Medicare. It makes zero sense. It's probably hurting health, and it's definitely driving up costs by preventing people from getting the care they need on a routine basis and sending them into much higher, more expensive settings. So I'm optimistic. But I'm generally a glass half full kind of guy anyway. So, but I think everyone on this call, please endorse the bill, sign on to the stakeholder letter, get in touch with your member of Congress, and tell them what we need these changes.
Chris, I'd love for you to look into your crystal ball a little bit and think about, what do you think the likelihood is for Congress to actually take up this legislation prior to the election? We do have an election coming up.
Jen, that was for me.
Yeah.
I operate in a world with a Kristen, Crystal. So when someone says Chris, I'm never sure.
No pun intended with crystal ball, but.
And my crystal ball.
Yeah.
I mean, it goes back to whether we can show answers on cost, fraud and abuse, and quality. I mean, there is a huge difference between making emergency policy and making long-term policy. So it is incumbent on all of us as stakeholders to bring answers. You've heard Representative Schweikert, he's saying we need modeling. So, we would love to send around our utilization chart and have people replicate it. So we can say, look at these 25 instances where, people collected data and we didn't see an overutilization. They are worried about overutilization. And that's the both patient and provider behavior. And on the provider behavior side, they're worried about fraud and abuse. And, we all represent, good actors in the marketplace, but there's always people in healthcare who are looking to take advantage new reimbursement opportunities, let's say. So, so I think, again, the answer on the crystal ball is it's up to us. It really is. The pressure is there. We now have a constituency of seniors that care about this that we didn't have before. You know, people have tried it, they like it, they're going to expect it. So all the stars are aligned for us. But again, you know, members of Congress have to deal with CBO and they don't have the data to bring to CBO. We do. So let's do it.
Yeah. Hal, I want to go back to you for a minute because you made an interesting comment earlier. You said technology is not the biggest challenge here. And Krista commented a little bit earlier on, you know, the provider adoption, and I'd love you to talk a little bit about what some of the challenges actually are with providers and physicians.
Yeah, thank you, Jen. I think whenever you go to any implementation of a project, it comes down to people, process, and technology, right? So I can have all the technology in the world, but we heard earlier comments about the resistance to telehealth. It changes the way we deliver care. Those are people and process issues. And for any of us, and all of us in this panel, obviously, that have been in the front lines and been a part of the transformation and the adoption of digital health, telehealth, remote monitoring, we understand that this is much a cultural environment as anything else. As we've been shifting from a engagement, or should we say, point-to-point conversation to asynchronous or synchronous type of communication from a digital health standpoint. And both of those are absolutely correct, because most of our things in digital in terms of images are all, you know, asynchronous. So you have to take a look at the overall picture. I think getting back to the two key points from a technology standpoint, the United States invested billions of dollars through meaningful use in the development and putting in electronic medical records and the technology backbone, if you would, to have the availability of patient records. This is an amazing platform that we've invested in. The use of telehealth is really the fruits of that labor. And I just didn't want us to skip over that. We've heard different individuals in the administration often talked about, well, what did we get for the investment? And that's the right question. What did we get? Well, what we got was the ability to respond to the COVID-19 crisis because of part of the technology that was put in our ability to get a hold of records. I cannot even imagine what a physician would do if they had to talk to a patient on the phone and they didn't have an electronic medical record to pull up the information. Are they going to drive back to their office and try and pull out the records off of the shelf in anticipation of what calls they may have in the next day or so? It's a giant step backwards. And if you look across the EU and if you look across the world, they're all trying to catch up now to the investment that the US put in. And that's also been spurred on by the COVID-19. So I really don't see the technology as an inhibitor. We don't have to reinvent new wheels. We have all the technology we need. We need better deployment, no question about it, from a high-speed internet standpoint and an access to the technology. But the technology itself is already there, and we put that in place in the United States.
Hal, that is really such a great point that, you know, this is the return on investment for a lot of the meaningful use investment that providers made and the federal government made. What a great point. We wouldn't be able to do that without the electronic health record. So thank you for making that point. Very important. I want to spend just a moment talking about mental health because it is so important. And telehealth, as Anne mentioned earlier, has really been a significant boom, I guess, for patients who are trying to access mental health. We've seen this with case studies across the country now. And as Anne mentioned, you know, access to care and no-show appointments actually are going down and sometimes much, much better because it's much easier for patients to get online. I was wondering if you could comment a little bit, Anne, on the mental health piece and kind of the impact of telehealth on mental health and what else you've heard and seen in the industry, because this is so important.
Sure, and thank you. I would say that the ATA has a telemental health special interest group that, like other special interest groups within the ATA, have published practice guidelines. Theirs were published in 2018, and they were endorsed by the American Psychiatric Association. And the headline of those practice guidelines, if I may, is to say that virtual is as good, if not better, than face-to-face when it comes to telemental health. And so I think that what we've really pushed for, along with many of our colleagues here on the call, is the notion of advocating around making sure that telemental health services are more broadly available through communities, through schools, to really ensure that they are broad and widespread. And the reason being is because there is a significant shortage of clinicians. So I think the impact that we've seen with the pandemic has been to underscore the importance and the ease of it. There is, as noted previously, the ability to interact with your clinician using audio video and not going to an office often removes stigma for a lot of folks. So I just think there are just enormous benefits that we're just beginning to surface. So.
Well, we've got a few minutes here, so I'd love to give every panelist just an opportunity to make a few closing comments here. Perhaps, you know, what are your thoughts in terms of where this legislation goes and the future impact of telehealth right now? Joel, I would love to start with you because you're such an expert in this area. Oh, wait, you're on mute. There you go.
Unforced error there, huh? Get back to baseball. Just Jen, thank you, and to everyone. This group has come together really to, in a quick way, to make sure that we have this legislation so that we can rally around it, so that we can get this done. We are having a telehealth moment. We are having a great point in history where the external factors, the illness, the disease is driving a technology response that is benefiting patients in a big way, and it's translating into informed advocacy that is making Congress sit up and take notice. It's also changing how care is being delivered at the practice level. And that's translating into how we're paying for care. We have one member, it's a major national health insurer. Their number of telehealth visits last year, total number, was about 1 million. This first 6 months of this year, they're at 9 million visits. And so the curve has definitely gone up. It's gone down a little bit now with in-person care. But I feel like we've turned a corner and people have gotten a lot more comfortable with using telehealth and receiving care in the home or in the urban or suburban settings. And that's great. And so we need to kind of take this to the hoop and score the touchdown, win the game, whatever sports analogies, other analogies I can make. But I would just reiterate where I think we're at. We did see, as Krista indicated, the draft deal come out, another temporary extension here. I think that if every group on this call simply endorsed the bill by signing onto this letter or writing your own letter and making 1 or 2 calls into Congress, we would have a tidal wave of messaging in that would show members that there's broad support for this. And the other thing I want to say is just as a means of encouragement, I think we hear a lot from congressional staff and from administration, the bureaucrats who've run programs for a long time. I don't mean that as a pejorative. They do great work in running these programs. I think, they might still be bought into the old way of thinking. So to the extent that we can show them that this really is a telehealth moment, that we've turned a corner, that there's a new way of delivering care that people are hungry for, we need to deliver that message as well. So endorse the bill, sign on to the letter, contact your member of Congress. We can win this. Thank you.
Love it. Great, Joel. Cal, I think all the sports metaphors are taken, but any comments, closing comments there?
I'm definitely going to skip the sports metaphor, and we're not doing many of them right now anyway. Listen, from the perspective of the FQHCs and the RHCs, we have a significant challenge, even if COVID-19 did not come around, on access to quality physicians and clinician care. This is just very fundamental. And as I mentioned earlier, we have a gigantic physician gap in this country, which is only growing. The use of telehealth and digital health as a means of access and extending quality to all individuals is absolutely imperative. And this bill does represent our telehealth moment. It drives the value, it's a return on investment, and it's an imperative for equality. So I just cannot ask everyone to do anything more than what Joel did in a perfect layup. I had to put that in there for you, Joel. A perfect layup in the summary of what we need to do collectively to get this bill passed.
Great, thank you. Krista, you can try to top that, but I do think they're all taken now.
No, I'm not going to try to top it. I'm just going to say Washington operates often on conventional wisdom. Things that people believe are conventional wisdom seem to happen. So let's make it conventional wisdom that this bill is the consensus bill and that will be the one that passes.
Great, thanks, Krista. And Ann, we're going to end with you. You started us off at the top, our leader of the APA and leader of this movement for many years. Any closing comments?
Thank you. Yes, I think that the bill reflects that this is an incredibly bipartisan issue, and it's up to us to rally behind it and move it forward. And to the point of conventional wisdom, what we're showing is that telehealth is health, and it's up to us to make it happen.
Love that. And this is our moment, I think. And I do want to thank the one thing I think all these 5 groups working together has been tremendous today on the call. And I appreciate everybody getting involved and engaged, and all the organizations listed there, all the logos there. We need your support. Thank you for joining us today. This is our moment, so please step up and sign the stakeholder letter. And we appreciate you joining us today. And thanks to all of our wonderful panelists and the congressmen. Thank you.
Thank you, Jen, for moderating. It's great.
Have a great day, everybody.
Thank you.
Thanks.